tool in your entire dental practice isn't actually a tool at all. Today, we're going to look past all the fancy high-tech scanners and drills to really dig into the one factor that truly engineers a clinic for excellence, and that's its design.
So when you think world-class dental clinic, what's the very first thing that pops into your head? I bet for most of us, it's the latest gadgets, right? Advanced imaging, new procedural tools. And hey, those things are absolutely important. But are they the whole story?
Well, it turns out the answer might be hiding in plain sight. It's not just about the technology you're using, but the actual environment you're working in. The foundation of a world-class experience is, well, literally the foundation of the room itself.
It's a real game changer. They make the case that the best clinics aren't just driven by tech, they're engineered by experience. It's a subtle difference, but it's a really powerful shift in thinking. This quote right here gets straight to the heart of it. Long before a patient ever experiences your skill as a clinician, they experience your clinic's environment. And that physical space, it's doing two critical jobs at the exact same time. It's setting that all-important first impression for the patient, and it's driving your team's workflow, for better or for worse. So let's start with that first impression. Because when it comes to defining your brand, your physical space is often the loudest voice in the room. I mean, think about it. From the second a patient walks in, they are forming an opinion. They're subconsciously sizing up the quality of care they think they're about to get, all based on the environment around them. Your brand isn't just a logo, it's the feeling your space gives off. Every single piece of furniture is part of that conversation. That dental chair, it's not just equipment, it's communicating comfort and safety. And the cabinetry, that's not just for storage, it conveys a sense of organization and professionalism. Altogether, these things suggest a super high standard of care, and they work to create that unforgettable positive impression.
But let's be real, aesthetics are only half the equation. A clinic can't just look good, it has to perform. And that's where the hard engineering principles become completely non-negotiable.
And it really all comes down to a trio of core priorities. First, hygiene. We're talking materials that can be perfectly sanitized every single time. Second, durability, making sure the equipment can handle the daily grind of a busy clinic. And third, efficiency, engineering the whole workspace to save those precious seconds. You just can't compromise on any of them. So what's holding up those three pillars? Well, it boils down to two key things: using medical-grade materials and having an intelligent design. You need surfaces that are totally non-porous and can be sanitized in an instant, and a layout where every single movement is intuitive. That is how you make every second count. Okay, so let's make this a little more tangible. How do these principles of engineering and design actually show up in the equipment that a clinical team uses every single day? It all starts with the chair. See, an advanced dental chair isn't just about making the patient comfortable. It's an active tool for the clinician, engineered to give them the stability and access they need, which allows for way more precise movements and better outcomes during those complex procedures.
And that same principle applies to the cabinetry. When it's modular and really thoughtfully designed, it completely changes the workflow. Your instruments are exactly where you need them when you need them, which cuts down on wasted motion and keeps the focus entirely on the patient.
And hey, we can't forget about the clinician's well-being. Ergonomic operator stools are such a critical investment. They're built to provide support and reduce that physical strain during long sessions. And that translates directly to sustained focus, higher performance, and honestly, a longer career. So when you put all these pieces together, the brand-defining look and feel, the core engineering, the functional parts, you get something much more than just a room full of equipment. You get an engineered partner, a workspace that is actively supporting the clinical team in delivering the absolute best care possible.
And that leaves us with one final and, I think, crucial question to think about. I want you to take a hard look at your own clinical environment. Is it just a passive collection of objects that you have to constantly work around? Or is it an active, integrated system that actually works with you? Is your workspace an obstacle? Or is it truly your greatest partner in delivering excellence?